Morning, good afternoon, and good evening. This is Dr. Scott Worden, the TOS guy. Welcome to our live stream for today. We're going to have a unique topic which we have covered before called the 5 things that every TOS patient needs to know. When we covered it before, we got a lot of patient feedback. And so we've reorganized it a little bit and added a lot of that feedback to help people understand where we're going. It's a short talk. We'll have plenty of room for questions and hopefully good answers from me. So let's get started. 5 things that every TOS patient should know. Here's the list. We're going to go through them one at a time. Take a look and we'll flesh it out from here. Now let's make a point here. TOS happens to major league athletes. They can get the best of care. But you don't have to be a major league athlete. You can be a sonographer. You can be a worker in a ton of jobs. This woman has a nice smile, looks like she's being very positive, but you know what? She's got to reach up and down inside that truck. She's got to drive with her arms in front of her. She's got to carry boxes light and big, small and heavy. It's a tough job. And I think during the pandemic, we've come to appreciate these people who are delivering everything from Amazon and everything from B&H Photo and everything from everywhere you order. And then you can just be a regular Joe or a regular Jane.
Dr. Worden, just want to let you know that your presentation is not up.
Okay. I'm going to start again here. Bear with me. Let's try to fix that sharing. I'll have to learn how to use computers one of these days. All right, entire screen. Let's allow. Let's go back to our presentation and keep our fingers crossed and see how this one works. How are we doing, Herb?
You're good.
Right. Good. We're going to start from the beginning. 5 things every TOS patient should know. Here's the list of 5 for everybody to have a look at. We will cover each point in turn. As I was saying, major league athletes get TOS. They get great care. But regular folks, like this sonographer, who works all day long in strange, unergonomic positions. This UPS worker who reaches high and low, carries small and heavy boxes or big and bulky ones. And everybody here who's listening who uses a laptop potentially can get TOS. So it doesn't matter if you're an athlete or a regular Jane or a regular Joe, you can get TOS. Now let's keep in mind, in our opinion, and I think in the opinion of a lot of the world, Thoracic Outlet Syndrome is one of the most challenging diagnoses for physicians and for patients. Our goal here at Vanguard Specialty Imaging is to help every doctor and every patient navigate TOS. That starts with being aware of the disease, to understanding the basics of the disease, to understanding the diagnosis and the treatment and the recovery, as well as the emotional challenges that a lot of patients go through because this is a chronic pain disease. It's not easy. That's why we want to help. Now, unfortunately, at present, a lot of this responsibility does fall on your shoulders as a patient and your support group, whether it's family, friends, parents, husband or wife. And we aim to help with that as well by helping you build connections and understanding the process. So here is point number 1 of the 5 things every TOS patient should know. Advocate for yourself. There are a lot of stories we hear from patients every day. And a lot of them say, I saw 2 doctors and 3 doctors and 6 doctors. And they either didn't know that I had anything, or they told me to go away because it was in my head, or they didn't even know about TOS. Even if I brought up TOS, they didn't know it. So number 1, you as a patient, unfortunately, even with your pain, you got to be on that computer and opening those books, and you have to learn the basics of TOS. Now, luckily today, compared to 10 years ago or 20 years ago when I first started, there are a lot of great resources out there. This channel, toseducation.org, is constantly growing, constantly providing new guests, new viewpoints, and we're covering TOS bit by bit. But you can learn something every time you visit here, and I highly advocate coming here. Next, you can go to a website like the one I run, tosmri.com. The basic website is educational. We're starting a new blog. We accept lots of questions. Just reach out to us and we'll help. The next point, make connections, and learn from others. So there's a lot of big social media groups out there. For example, Facebook. Facebook has a couple of really big advocacy groups. Bear in mind, these are not run by professionals. Medical professionals of any sort are kept out of these groups so that patients can share freely. Understand that these patients are not trained in medicine. They've had a lot of experience, and we can certainly learn a lot from that experience. But take a grain of salt with you when you go in. It's not medical advice. It's a start of a pathway to go down so you can find medical experts in TOS. All right, we know we have lots of experience with patients who work through us. We organize with their doctors. We get them scans. Sometimes we just get them to the right doctors without our scans. And we know a lot of those success stories. We had a couple of weeks ago a really nice young woman who's been through TOS and had a lot of challenges, and she's got a very strong will, and she's working her way through it. And we have other patients coming up who can tell their positive stories, how better they got when they got the right treatment. So bear in mind, social media groups will have, in general, some patients who are really struggling, because the good ones, they get rid of their TOS and they go on to a new life. Keep that in mind, please. Then the third point here is for you to find your best physician partner. You need somebody who can quarterback your care. It could be a primary care doc, and she or he may not know a lot about TOS, but they can reach out to me. They can reach out to surgeons, to other specialists in TOS, and they can make sure that you see the right number of specialists, get the right tests, get the right treatment, see the right physical therapists, etc., etc. You want that one person helping you advocate, because it's a tough job, and moving you to the next level and coordinating all your care. So you want a quarterback, you want your best physician partner. All right, step number 2, find TOS expertise. We get more demands for this than just about anything else. How do I find a TOS specialist? Well, nobody really advertises like they could, and there's no specialty that really handles TOS by itself. So as I always say, if you break a bone, you see an orthopedist. If you have a heart attack, God forbid, you see a cardiologist. But you know what? If you have TOS, there is no single specialty. There are people who are experienced in TOS, and you need to find them. And you can't look up a neurologist, and you can't look up a physiatrist. You have to find them by this specialty. So, point number 2, many doctors have little or no TOS expertise. That's most doctors, really. But underneath there, point number 3, there is a small and limited number of docs that we know who have really exceptional TOS expertise. These are people who have seen the disease a million times. They've read the literature. They know what's happening. Now, among those people, and I count myself as one of those because I've tried to help focus on it to help folks like you, we have different opinions. That's okay. There are different opinions among cardiologists. There are different opinions among brain surgeons. That's normal. Anytime you want to push the boundaries and learn something new, you're going to find dead ends to go down or real avenues of growth. So don't worry about that, but worry about finding the few people who do have expertise. And you know what? We can help you with that. Come to tosmri.com, reach out to us. We'll find the people that are closest to you, as well as the people that are the most experienced anywhere in the country. Point number 3, make deliberate decisions. I'll start this off by sharing a few patients that have come to us and said, I am suffering, I can't stand it anymore, no one's helping me. I found a doctor who will do X, Y, Z, and I'm going for it. And we try to counsel them, we try to make sure they get their full dose of data on this. Sometimes it's a good procedure and sometimes it's not. But we know when you're suffering for a long time, when the pain is as bad as this, when the pain affects your activities of daily living, you can't drive your car, you can't go on social media, you can't hold your baby, well, there's a strong incentive to get it fixed and get it fixed now. We believe you need to do your research and make careful decisions. Do not rush to surgery, which is permanent. Okay? You need to get a few different opinions, and you will learn after you get 2, and better after you get 3, what is widely accepted and what may be more experimental or risky. So, very well-informed, careful decisions. Please don't rush to surgery, even though the promise of it means I want a better life by tomorrow. It's a permanent change, and it may not always work. There are plenty of good surgeons, and sometimes they can't help right away, but it still is the better choice long term. So let people like us steer you to the right experts, help you understand the literature, help you understand the disease, and make those careful decisions. Point number 4, understand the big picture. And you see the 3 points I listed here. Yes, TOS is complex. And yes, it's controversial, but not for a good reason. And finally, TOS is real. Now, I talk about this occasionally. TOS was first noted more than 200 years ago. Over those 200 years, there have been some of the most famous people in the history of medicine who have researched and published about TOS. Very famous people. Maybe you heard of Michael DeBakey. He's the guy who came up with the concept of the MASH unit in the Korean War. Ultra famous among medical people for all his work in cardiac surgery. Plenty of other people just like him, really, really famous, really widely respected. And none of them had any problem with TOS except the problem you might expect. What is this disease? How do we figure this out? Now, a lot of them, for the first 140, 150 of those years, didn't have imaging tools. They didn't have ultrasound. They didn't have X-ray to the quality we have now. They didn't have CAT scans or MRIs. So they had to do things in a different way. But that's been changing with technology, and we have a lot better understanding now through modern technology, which particularly means imaging. And that's my bias, but imaging has grown tremendously. There's a guy named Godfrey Hounsfield who really did the work to create the first CAT scan image. It was a person whose head was in a water bath, and they got one slice, and it took a minute to get one little slice of their brain. But there's Godfrey Hounsfield that night looking at the inside of a living person's skull, looking at a living brain, and it hadn't been done before with imaging. CAT scan has gone on to be really fast and really useful for everything, and it's still growing. People are still finding new applications. Okay, so this technology is awesome, and it can help. Now, the controversy of TOS came up in the late 1980s because a doctor who was very widely regarded took a group of patients who had a diagnosis of TOS, and he did EMGs, and the EMGs were mostly negative. And he said, well, if the EMG is negative, they can't have any disease. Now, it turns out he could have also said, well, maybe EMG just doesn't work. And EMG doesn't work for this disease. But he created a category of TOS that he calls disputed neurogenic TOS. Now, he admits there's real neurogenic TOS as long as the muscles in your hand are wasting away to nothing. And by that point, folks, you're disabled. You can't use your hands because your muscles have all gone away. If you treat that with surgery, vast majority of cases, that function won't come back. So our job as doctors is not to wait until that advanced disease, it's to find the early disease. But that's what this guy called disputed TOS. Now, unfortunately, because TOS is complex, a lot of doctors say, I don't get it. It's going to take a lot of work to figure this out. But you know what? It's disputed, and therefore I'm never going to see it. It's really rare. It's 1 in a million. Doesn't exist. And that hurts everybody, from people like me who try to help patients, but mostly the patients who really need the help. So understand the big picture. We are all too glad to tell you all the stories and share all the facts, but TOS is absolutely real. There's a couple thousand to 3,000 papers in the medical literature that are peer-reviewed. No one nowadays really should be questioning the diagnosis. If you get a doctor who says, yeah, TOS, roll my eyes, you go to a different doctor. And don't be discouraged. If you get a doc who says you don't have the loss of muscles in your hand and you can't have TOS, you get a different doctor. If you get a doc that said, I did an EMG, it's normal, who knows what it is, you get a different doctor. Okay? We do lots of educational stuff on this, and we'll help guide you if you need personal help. Big picture. And then finally, you need a team. I mentioned a quarterback before. Quarterback might be your primary care physician, might be a pain management doc, it might be a surgeon, but you need someone to coordinate your care. As you see here, it's what I've said, there is no single perfect diagnostic test for TOS. When your doc sees you in her office, she can do all kinds of maneuvers and specialized exams, and she can suspect TOS. That's a good doc. But confirming it, there's no literature that shows anywhere near 100% for any of these clinical tests. Now, We believe that our test, our MRI, shows a lot, and it's really good, and there's a whole lot of data to back it up. But I won't claim it's perfect because there is no gold standard to compare it against. But when we combine our MRI with the clinical exam your doc does, we're getting pretty darn close. All right? Trust me, there's no perfect single diagnostic test, just like there's no single best treatment. TOS is complex, and there are different types of TOS. On my website, I've listed about 25 different names TOS has been called because different doctors found different kinds of patients. They found different maneuvers that would provoke the symptoms. It's not one disease. In 1956, a physical therapist in training said, "Why don't we just lump them all together? I just don't get it. It's too complex." He actually said there are multiple anatomic variations, there are multiple different symptoms, there are multiple different causes, so let's just lump it all together as one disease. Now that doesn't help. If you've got TOS, which type do you have? Do you have an extra scalene muscle? Do you have a fibrous band? Do you have a rib anomaly? Well, that's where imaging can help a lot. But it starts out with you, the patient, understanding that there are lots of different types, and your doctor saying, maybe I should get this nice advanced imaging and really see what's going on in there, especially before surgery. So there's no surgery I know of that people go to without getting imaging, and this should be no different. Finally, the point at the bottom that TOS patients often do best with multiple treatment modalities is very critical. Patients can go to surgery, but they'll need physical therapy afterwards. Patients may instead go to physical therapy with selective injections of a scalene muscle and the subclavius muscle and certain types of pain medication and maybe acupuncture. In general, what we found is you often need multiple treatments going on at the same time to help patients get better and recover. So the diagnosis of TOS may require a physician to be aware of TOS and to have some level of suspicion that when they see a patient with these kind of symptoms, that at least they think about TOS. They may not be skilled at the diagnosis, but they may know a specialist who can help them. Secondly, you need not just your standard neurologic examination. There's a very special examination in the doctor's office for neurogenic TOS. Several different tests that he or she can do that narrow it down and suggest neurogenic TOS. Then specialized imaging. We take pride in what we do. We're always trying to advance it. And we think that with our experience reading thousands of cases that we can really help most cases. Then I mentioned selective injections. Yes, some doctors will do scalene blocks or pectoralis minor blocks, and these are part of the diagnostic picture. So again, it's not one step here. It's not easy. There's no 100%. But by putting these different modalities together, we're getting pretty darn close to a diagnosis. And then in terms of treatment, it's the same thing. As I mentioned before, patients may get physical therapy, acupuncture, massage therapy. They may get selective injections. They may need certain kinds of medications, surgical treatment, and there are different types of surgical treatment. And often there's an emotional component because you, the patient, have had pain for a long time. Depression or anxiety are natural outcomes of chronic pain. We do hear of patients very frequently who after their fourth or fifth doctor, they're diagnosed with depression and nothing else. But you know what? You don't get pain from depression without thinking that maybe the pain came first and the depression came second. So it's a tough disease for a lot of reasons, and this emotional component should never be ignored. It's tough on patients, it's tough on their families, and it's tough on the doctors we work with who care about this. Anyway, this is TOS. It can be mild, little fender bender. It can be a big headache like this. And sometimes TOS is just like, what the heck? I have no idea. So let's remember those 5 things. Advocate for yourself. Make yourself smart. Find good allies. People who can teach you and connect with you. Find real TOS expertise. It doesn't matter if it's the Mayo Clinic or the Cleveland Clinic or Massachusetts General Hospital. It's not the title, it's not the institution. You want to find that doc who specializes and is experienced in TOS. You want to make careful and deliberate decisions. Don't rush to surgery especially. But you got to have a little knowledge yourself, unfortunately. The responsibility falls on you to know enough about this. Understand the big picture. Don't let anybody talk you out of it. TOS is real. It's tough, it's challenging for the physician and the patient, but there are a lot of pathways to get better. Trust me. And finally, make sure you have a team. You're going to need your family to work with you and your doctors. And your doctor, even if it's one person, but better if it's multiple, you want one person in charge of that care. All right, and I will thank you for attending this brief live stream. I want to take questions now, so I'm going to turn off my presentation and go back to Herb, and let's see what we got here. All right, I'll read this first one. This may seem like a silly question, but what are the most common symptoms for TOS? I think that my teen daughter may have TOS. So Billy from Los Angeles, thank you. You are fortunately in an area in Los Angeles where there has been TOS awareness for several decades. We have imaging partners down there. We work with a lot of docs in the area, and there are some great docs, people like Hugh Gelibert at UCLA. There's Vernon Williams at Cedars-Sinai, and Dr. Mitch Soria, an excellent peripheral nerve surgeon at Cedars-Sinai, and others. So you're fortunate that there are docs down there. In terms of the most common symptoms, I wouldn't list them in order of frequency, but common symptoms in general would be neck pain, pain radiating down the arms in general to the fingers. The most common pattern in that case would be along the inside of the forearm to the two fingers, the little finger and half of the ring finger. Oftentimes the symptoms are exacerbated by a day's worth of work, or a student studying on a laptop at school, or people who use their arms in front of them like hairdressers we hear a lot. So the pattern will be that they'll get the worst pain by the end of their day, and it will tend to get better overnight. But eventually, if things aren't resolved, what will happen is they'll get pain during the day and it won't go away overnight. It will go away on the weekend. But eventually that grace period goes away and they have pain all the time. They tend to absorb this pain until they assume abnormal postures like rolling their shoulders forward, so they can release the pressure on the nerves as much as possible. And eventually this makes it worse, where their head is hunched forward, their shoulders are hunched forward. Okay? So keep in mind, common causes can be athletics, particularly overhead athletics, basketball players, tennis players, swimmers, volleyball players. The number one draft in the NBA, Markelle Fultz, he got TOS. Baseball pitchers and third basemen get it from throwing. So athletic activity, laptop use, and device use in general, because it's always not ergonomic. And then typical things we do at work, occupational stuff, can frequently cause TOS. Abby from Northern California asks, are headaches common with TOS? And the answer is absolutely yes. We believe that in many cases of TOS, but not all, there is abnormal drainage of the veins that come from the arms and shoulders back to the chest. We can show this on MRI. It's been shown in the literature. But we also believe that there is limited drainage of blood through the veins of the head and neck. And this has been talked about as chronic cerebrospinal venous insufficiency. I believe that's the term, CCSVI. And that may cause symptoms because the blood is backed up and it doesn't drain easily. So the pressure, the vascular pressure in the head, can be abnormal. Now, an Italian doctor thought that this was one of the causes of multiple sclerosis. And there's a big to-do about that. But we do believe that headaches are caused by this abnormal balance of the blood coming in and the blood going out. And then, of course, there are tension headaches because people are in such pain and they reposition their shoulder girdles and their neck to try to get the most comfortable position. Over time, those muscles get very stressed and they can cause pain. A doctor in St. Louis, Robert Hagen, works on occipital neuralgia. Another doc, Ziv Pellet in San Francisco, works on this. And we believe that the fascia, the thick layers of tissue, like sheets of tissue along the back of the head, they have certain holes for the nerves to go through. And if they get too tight because the muscles are pulling on these sheets of fascia, it can distort those holes and put pressure on those nerves, causing a different type of headache. So the answer is yes, headaches are common with TOS. Now, if you have a headache, you don't necessarily have TOS. The two things by themselves have a certain amount of commonness and a certain amount of overlap. Do I know of any physicians in Brazil that treat TOS? I'm going to have to say no, I don't. I think you can search for it. You might call up a vascular surgeon or even the Society of Vascular Surgeons. They tend to be the most common group that diagnose and treat TOS. Do a web search and find vascular surgeons in your area, your city. Certainly, you can email us and we'll try to help you do that search. Contact us on tosmri.com. And if you find people, let us know, because we always want to be able to provide information for the next patient that asks the question. Let's see if I have other questions here. All right. I saw that you mentioned baseball pitchers. How common is that really for guys like me? Bunky in Florida. Hey, Bunky, how are you? So it's hard to go backwards. What we do know is we've had several elite major league pitchers diagnosed with TOS. Matt Harvey was one. As a long-time Mets fan, it's been tough. Matt Harvey was he was a star in the dark, and he was awesome for a few years. And then he got TOS, and he got treated, but he has not been the same. All overhead athletes are predisposed to TOS because they're really tightening up the space between the collarbone and the rib. They're altering the balance of muscles between the front and back of the shoulder. So even at rest, when they're not doing their job, the shoulders are in abnormal positions and the collarbone may be pulled down too tight against the first rib. But even within that population, people like David Cone, who pitched a perfect game for the Yankees. By the way, he was on the Mets, but he never pitched a perfect game for them. This is what happens when you're a Mets fan. He did for the Yankees, but he was found to have an aneurysm out here in the arm. It was called TOS. It's just a different type than other people have. So we do know overhead athletes get this. If you're a baseball pitcher and you have symptoms, it certainly is two things adding up: your job, your hobby, your activity, along with the symptoms. So I would see a doctor who is experienced in this. We do know doctors. We have an imaging partner in Florida. If Bunky reach out to us by email through my website, we can help connect you with doctors who know TOS. Next question. My sister has TOS. She's a teen soccer player, and she swears it started when she fell and broke her wrist. Is that possible? Hi, Katie in Chicago. How are you? I'm sorry to hear about her falling and breaking her wrist. Glad to hear that she's a soccer player. Keeps you in great shape. So the wrist fracture by itself should not cause TOS. However, a significant injury to the upper extremity could have at the same time transmitted shock and stress into the muscles of the shoulder and the neck. So by itself, a wrist fracture is not an indication for TOS, but the injury and the sport is. Again, if she has symptoms, we believe TOS is quite common, much more than is reported in the literature. And she should see a doc who's got reasonable experience and can say, no, I think it's rotator cuff stress, or I think it's a deltoid strain. But you want to get a professional who knows TOS reasonably. Okay? Hope that's helpful. I just finished watching your TOS anatomy talk before joining this event. I am still a little confused about how all the parts of the shoulder can cause TOS. And this is Mick from London University. London? Okay. London, England. So it's a bit of a broad question, and I'll try to narrow it down, but please ask again if I'm not helping your curiosity. There are shoulder muscles that are all attached to the shoulder blade. Shoulder blade is a big fat piece of bone that sits on the back of your shoulder, and it slides in many directions. The rotator cuff is a series of 4 muscles that starts on the shoulder blade and ends on the upper arm like this, 4 muscles. Now, those muscles are sort of independent of thoracic outlet syndrome because it's closer here where the collarbone meets the rib. Now, there are a series of muscles along your back, your neck, your chest that all attach to the scapula or shoulder blade. In fact, there are 17 different muscles that attach to the shoulder blade. If those muscles are in balance, things work great. If those muscles are out of balance, they can do a number of things, not just TOS. But we do know that imbalance between the front muscles and the back muscles can definitely shift the position of the shoulder blade and bring the collarbone then down closer to the first rib. To help make that clear, the shoulder blade just slides over the chest wall. It's got one attachment out here, a pivot point to the collarbone, which comes across here and has one pivot point right here. The shoulder is the most mobile joint in the body. You can move it endless directions. But because of that mobility, it can also be pulled in a different direction by imbalance between these muscles. Not the rotator cuff, but a series of other muscles. The trapezius is a very large muscle along your neck, your back, your shoulder. Okay, that can pull the scapula or shoulder blade in different directions. There's a pectoralis minor muscle deep inside here that can pull the shoulder blade forward. You may have heard of a pectoralis minor tenotomy or a pectoralis minor block, where you numb up the muscle. Those procedures are intended to allow the shoulder blade to slide back farther and open up the space between the collarbone and the rib. If you want to reach out and get more information, I'm glad to provide it. It's a complex topic, a great question. All by itself could spend an hour on that, and maybe we will. Next question. Terry. Hi, Terry. Is there a first part of the question? Looks like we're starting in the middle here. Let's see. I'm going to find the comments. Well, it starts with they can get better and move on with life. Would you say that TOS is curable without surgery, or would you say that it can be manageable without surgery, a combination of both, or other? So every patient, Terry, is different. We have in the past seen lots of patients who had TOS for 10 years or more. It makes it very tough to get it better completely. We work with those patients. We try to connect them with people that we know that can work with chronic pain and start repositioning, improving posture, improving breathing. There are variable degrees of improvement. We believe that now we've been moving to an era where we're getting more people aware of the diagnosis. They know TOS a little bit more, maybe because some of these famous baseball pitchers get diagnosed, but they get recognized earlier. Maybe they only see 3 docs instead of 10 docs. And because they start being recognized earlier, they start getting treated earlier. And so we have a better pathway to improvement. Each case is different. There are different causes underneath. Surgeries are different. So I can't give you a uniform picture on, is surgery curable? Is it manageable without surgery? The real answer is you need a dedicated team. You need people who know the disease and get you the optimal treatment. It's certainly, there are cases where it's gotten better without surgery. Okay, I don't know if that applies to you. In your family, there are cases where it looks like it's easily manageable without surgery and turns out not to be so. I was speaking to a very famous TOS surgeon in Boston not too long ago, and we were sharing ideas. This guy would tell me that he gets young, healthy patients, TOS that he's sure he can cure with surgery, and they just do okay. And then other patients he gets who are very complex have had it a long time. When he does surgery half-heartedly, he's not sure it's going to work, and they get better, a lot better, or completely better. So we don't understand the predictive value of any particular type of surgery, but we are hoping to improve that. And I believe that our imaging, and if other people do imaging, that data will help contribute to our understanding. When we start doing studies that we've seen X, Y, Z on an imaging study, and the patient gets ABC procedure, and they get better, that will help us in the future. But that data isn't really available now. So I'm sorry it's an incomplete question, but the best thing we can do is help each patient individually. Thank you. Buddy Lee, TOS was confirmed at the beginning of this year with an MRI. My previous team of longtime chiropractors proved worthless. A new chiropractor is proving very helpful, but I can't see him more than 2 times a month. Do you have advice? So the reason you can't see your new chiropractor, I don't know if that's because of insurance. I'm really glad that you found somebody who knows the disease and who's helping you. That's a good start. I don't know if you can add somebody else in between, a physical therapist that your chiropractor might recommend, or we can help connect you with people you could chat with. We're not here right now, unfortunately, to make a specific diagnosis or specific medical advice, so I want to be careful around that. But if you want to contact us separately, that's not on a public forum, we're glad to help you. Of course, you have a good chiropractor, I'd love to meet her or him, just so we can provide them other patients, since this person knows TOS and is helping you. All right, so I don't want to give specific medical advice. Please reach out through the website, tosmri.com, the contact us page, and let us try to help you that way. but I am glad that you're getting better with a good caregiver. All right, Julie Dunn. My TOS surgeon thinks because it didn't hurt when he pressed lightly around my collarbone that it's a low probability of TOS. Is this usually true? That's a good question. So some of the clinical tests for TOS include pressing directly on the brachial plexus. I mean, really pressing on it or tapping on it. Something called a Tinel's test that's done in other parts of the body when a doctor thinks you have an entrapment neuropathy. If there's an entrapment neuropathy and the nerve is somewhat damaged and sensitive, tapping on it should reproduce some of the symptoms, like send little shock waves down the arms. Not necessarily uncomfortable. It's worth it for your doc to do this. I've not heard of pressing lightly on the collarbone. In the past, people have taken patients' shoulders and pushed them down pretty hard to see if they could make it happen. Lightly touching may not have any effect because your muscles are going to be really tight. If you have TOS, you're going to have pain because of the pressure on the nerve, and your body is going to be like this, guarding against any motion like that. See it all the time. Matter of fact, people's shoulders end up like this because they don't want the collarbone touching the plexus. So someone pressing lightly is not going to be the answer. It won't really definitively rule it out in general. Secondly, none of the clinical tests, even Tinel's test, the other tests, none of them are 100% or really even close. Again, I obviously am biased. I think our imaging test helps a lot. We are glad to do imaging. If you want to reach out to us, we can tell you the pluses and minuses of it. We're glad to meet your doctor. I always reach out to doctors and speak with them on behalf of patients and offer the help that we can help. Even I offer to connect them to other doctors if we're not involved. So yes, we love to do scans, but we also love to help patients find the right people. So in short, I think pressing lightly on the collarbone is not necessarily the answer. There should be other tests that are done, like an upper limb neural tension test, like a Ruse test, like a Tinel test, and those should be looked at. But again, none of them are perfect. None of them pick up all cases, and none of them prove all cases. I hope that's helpful. Angela, hi. What tests can diagnose this? I've had TOS since 2012 from whiplash, and I have all the symptoms and more. I've had an MRI, an X-ray, and a nerve test, and all were negative, except for narrowing of space between the discs on C4 and C5. Okay, Angela, narrowing of the discs by itself occurs with everybody once they hit the age of 30. You look younger than that from your picture, but it can occur. It doesn't necessarily mean that it causes pain. And if you have pain going down your arms, a disc that's narrowed means nothing unless it's pressing on some of the nerve roots. I don't know if you've had an MRI of the brachial plexus or the thoracic outlet. It's highly specialized. I've created a technique and patented it with what we really think works the best. And this is through lots of consultations with other doctors, answering questions of TOS specialists and surgeons. We believe that we're on the forefront of using this modality, MRI, to the best effect for patients like you. We believe in combination with a clinical examination, if your doc finds signs in you that look like TOS, then our MRI in combination with that is the best option right now for people. Remember, MRI has no radiation to it. It's not like X-rays or a CAT scan. When you get one of those tests, you're getting a certain amount of radiation, and you don't want to just get one of those on a lark. You want to really think carefully. But MRI has no radiation. Additionally, you mentioned whiplash. Thank you. Whiplash is kind of a non-physiologic diagnosis. I think most people would assume that the muscles that hold up the neck and hold up the head, when you have a sudden back and forth motion of the head, that those muscles tighten up and then they get little micro tears, and that's whiplash. That's local pain, meaning it is right here. Once the pain starts going down your arms, especially if it's both arms, it's not whiplash anymore. Now you got to be thinking about two things: TOS or a herniated disc that's big enough to press on both sides in here, deep inside here in your spinal canal, that can be getting both nerves or maybe pressing on the spinal cord enough. But after a car accident with a neck injury, pain going down both arms, if that's what you have, you should be thinking TOS. Again, I don't want to give out specific medical advice for any individual here. These are general things. Please reach out to us through our website. We'll be glad to hear about your story, to look at your records, and to help steer you to the right people. Steve Adams, name I know well. Can you discuss? I just want to say my camera overheated because I've been using it for a while, so I'm going to talk without the camera being on. Steve says, can you discuss upper back pain in relation to TOS? That's a really good question for a couple reasons. The trapezius muscle is a really big muscle that goes along the back of your spine and your upper back, and it reaches out to grab onto the scapula or shoulder blade on each side. And when it does that, it actually can change the position of the scapula. It's one of the stronger muscles that does that. So if you have strains or stress on the trapezius muscle, you will change the position of your shoulder blade. And when you change the position of your shoulder blade, you can actually change the position of the collarbone, the clavicle. And when the clavicle gets too close to the first rib, then you're going to potentially squeeze the brachial plexus. Now, alternately, Steve, if you get thoracic outlet syndrome and you have a lot of pain, you are going to assume an unusual posture because you want that pain to go away. So you may actually tighten those muscles secondarily to the nerve pain. When the plexus is compressed, you're going to do this, you're going to get into different positions, you're going to sleep differently, you're going to work on laptops differently, and that may cause the trapezius, the biggest upper back muscle, to change position. It's the same thing for a whole series of other upper back muscles. So it's pretty common to have back pain or chest pain along with TOS that's unrelated to the nerve compression but is a secondary finding and in itself may contribute to a negative cycle. I hope that helps your question. Teresa, hi, can TOS cause dizzy or fainting spells? Since I'm not a clinical doc, I don't examine patients directly. I'm going to say that from the literature, there is evidence of that. We believe, as I described before, that there is some abnormal venous blood flow, that the venous blood flow under low pressure that normally drains from the head and the neck can be significantly limited in patients with TOS, as well as other diseases. And because of that, you can get tinnitus or ringing in the ears and maybe dizziness. So I would speak with your doctor about that. I would want to see if there are other signs and symptoms of TOS, but dizziness or ringing in the ears or fainting spells should not rule out TOS. They're just they can be caused by a lot of things other than TOS as well. Hi, Lori. I'm experiencing blurred vision more frequently. This and trigeminal and GN neuropathy. How often is TOS the culprit? So that's going to be a more complex question. I'm sorry. I appreciate the question, but I think it's going to be a little bit beyond what we can do here. And again, I don't want to give specific advice. I think that if you have trigeminal neuralgia, which can be severely painful, I know that you want to make sure you're working with a doc who understands trigeminal neuralgia. It's a not uncommon condition that's extremely painful, I know. And there are people who are really specialized, like I'm specialized in TOS. There are people who really specialize in working with this disease. So I don't want to step out of my bounds and offer advice that's not really backed up by a high level of knowledge. Sorry. See if we have more questions. Did you say earlier that headaches may be caused by TOS? The back of my head, the occipital muscles, that's correct, are in constant spasm and I get chronic headaches at the frontal, eye, and forehead area. Please share your thoughts. Yes, Buddy Lee. So headaches are frequently associated with TOS. I talked briefly about the pathways that the occipital nerves have to go through on the back of the scalp. And there is a layer of fascia, a sheet of tough connective tissue that has little holes in it to allow the occipital nerve on each side to pass through. If there is a lot of muscle contraction from your TOS, those sheets of fascia can be pulled abnormally, and those little holes may actually put pressure on and kink the occipital nerves. And oftentimes a doc will do a tiny injection of an anesthetic right at that little hole, and they'll find relief, and that will lead them to that idea that what's happening is at the fascia level. So yes, occipital headaches and occipital neuralgia can be associated with TOS? Thank you for the question. Karen says, she asked the question, could you please recommend doctors and physical therapists who treat TOS in San Francisco? Thank you. Karen, thank you for the question. We know a lot of people here. First thing I'll suggest is contact us through our website. I'll send you a list with phone numbers and addresses. We have a whole bunch of them. In Marin County, there's Tracy Newkirk, a neurologist who's got to have 40 years of experience. He's great. There are people in the city, David Smolens, Jim Avery is a surgeon. In the East Bay, there's a neurologist, Selena Ellis. There's a vascular surgeon, Niren Engel. There are physical therapists. In Marin, Janice Tamita does this. Nagid, I'm forgetting her last name in Berkeley, but Berkeley Community Physical Therapy. Spoken with her recently. Steve Talikowski in Hayward has a ton of experience with TOS. Todd Soares, Soares, in San Francisco as a physical therapist. So we have lots of these names, and I'm glad to pass them on to you. Please contact us directly. It'll make it easier for you. Thanks, Karen. Brad in Hollywood says, I have heard of this vest that a doctor in Northern California uses for TOS. Do you know anything about this? The short answer is yes, I do. You're probably talking about Tracy Newkirk, who over about 20 years has been working on this special orthotic vest. It contains solid fabric. It contains stretchy spandex types fabric at different areas. It contains flexible plastic stays, multiple adjustable buckles, and it's highly adjustable. The way he works with this vest is when he sees a patient for TOS, he will by hand manipulate the shoulder blade on one side or the other or both while he's looking at their signs, what's happening with their blood vessels, what's happening with their symptoms, headache, for example. He will then take special tape, physio tape, I think it's called, and tape these bones in specific positions, again, to see if this kind of manipulation helps resolve symptoms. And if he gets positive tests in a number of ways, he will offer them a vest. I think he has one in his office in general. It's just for trying on, because each one has to be adjusted to the size and shape of each patient, as well as adjusted for what Dr. Newkirk thinks is the cause of symptoms in each patient. So it's a highly complex vest. It's incredibly adjustable. Each one is custom made, and we've heard very good things about it. There was a plastic surgeon who had one of our scans, came to see Dr. Newkirk, clearly had TOS. He hadn't been working. And Dr. Newkirk saw him, worked with him, this method I just described, found that he was very responsive to this manipulation. So he made this doctor a custom vest. And now that surgeon is back at work, wearing the vest under his scrubs. And he's back, I think, to about 80% of his previous work before with a simple conservative approach like this. So yes, that can help. Tracy Newkirk, Newkirk. You can contact us if you want his phone number, but he should be easy to look up in Marin. I believe he's in Greenbrae. Buddy Lee says, thank you for your work you do. This is a passion for us, Buddy. We love talking with patients because our whole team feels good when somebody does better. And so we really love to help people with it. It's a challenge. It's ups and downs. You know, there's intellectual challenges. There's human challenges because we deal with so many people with different opinions. We deal with patients who are really struggling. You know, their whole life has changed. But the good thing is a lot of them get better and their life is restarted again. And that's really rewarding for my whole team. Teresa, do you work with any Kaiser MDs or patients? So we have worked with some Kaiser patients before. They have a different approach than we do to TOS. As you might expect in a large group like that, there are people who just say can't be TOS because there is no such thing. That's difficult for us to work with. There are other people who have a lot of knowledge about some other field, but they don't really know as much about TOS. One of the occupational problems about being a doctor is that you know everything about everything. I've learned enough from making enough mistakes that I may know a little tiny corner of the world and I know a lot about it, but there's so many things that I don't know nearly as much about. So I'm learning to keep my thoughts to myself in that regard when there's a good expert around. So, not everybody is respectful that way. We've had our dealings with Kaiser, both positive and minus, and we still talk very happily to Kaiser patients. I will let everybody know we talk to a lot of people. Some of them do get our scan, and a lot of them don't, but we're here to help. So if we refer you to a doctor, it's not because we're blowing you off. We think you should see a doctor who knows TOS before they refer you for one of our scans. We love to sell our ideas. We love to get our scans done, especially when they help patients. But we won't tell you to get our scan by itself. So if you're a Kaiser patient, we will help you review some of your records, find maybe one doctor outside of Kaiser for a second opinion, and see what that doctor thinks, whether you should pursue it further by pushing Kaiser or maybe getting your care from outside Kaiser and having them hire a specialist. I hope that's helpful. Looking at other questions here, bear with me. Julie says, do you review previously done MRIs or only the ones that you have done? So as part of our service, we can be hired for consulting on other images. We have done that before and not gotten additional scans, and that's been helpful for families and patients. I would say contact us on an individual basis. We'll do our best to help you the most economical way. It's hard for me to say this in detail, but we'll do our best. If you bring us scans and we say this probably won't help, we won't review it, so save some money, we'll do it that way. But certainly we'll try to find a way to get you through this complex medical stuff, tell you whether those are adequate for diagnosis or if you need further imaging. I think in most cases, I can either see evidence of thoracic outlet syndrome or I can say it's not helpful, let me send you to a doctor outside of us before you decide on our scan. So we always have it in mind that our scan, which is expensive, I understand, it's not covered by a lot of insurance, I understand. We will try to find you the best way to get an answer. Whether you really need our scan or not, it should go through another doctor who knows us and says yes or no, you do need it. So in short, we will try to help you with outside studies. Please contact us. Diane. Hi, Diane. Thank you for making these videos. You are most kind. I think thanks go to toseducation.org, run by Herb Rep, who has pioneered this and really run a lot of this. He's always recruiting other specialists in the field like Art Jenkins, and we'll have more coming up. We've gotten a great response to this, and that's been the best thing. We meet a lot of people this way, and hopefully we're helping spread the word. And we'll ask you also, all you folks who are watching, find us on social media, TOS MRI, on Instagram, Facebook, YouTube, Twitter. We're trying to get our social media programs up and running. For me, it's a bit of a challenge because I've never really used it before so much. Now I have to learn how to use social media better, but it helps spread the word for other people who come after you. So if we help you all and you help the people down the road, that's just a really good positive social effort. So thanks to Herb Rep and toseducation.org. Let's see if we have any further questions here. Okay, at this point, what I'm going to say is, number one, thank you everybody for attending. It's a lot of questions, and I really appreciate that. When people contribute and get this conversation going, we feel really good, like we're helping to spread the word. We're happy to talk with each and every one of you. Obviously, if it's for an individual medical case, please talk to us in private. We're glad to do that. We never charge to start with. Okay, if we're going to take a big amount of time, be official consultants, that's different. But we always try to at least steer you towards the right specialists who can help narrow things down. So don't hesitate, reach out to us. Again, please follow us on social media. That helps everybody. We have a talk coming up in 2 weeks on the 28th. We have a couple of guests that we're working on, but it's probably going to be an outside TOS expert from outside our organization. So we'll announce that on toseducation.org. If you sign up for their social media, you will get notified automatically. And otherwise, I'll be glad to see all of you next time. Please send us any questions you might have through my website, tosmri.com. Go to the last column over. I believe it says News and Education, and on there is a button that says Contact Us, and we will gladly get back to you. Anything else? No more questions? I'm going to say goodbye for now, and I'll look forward to seeing you again in 2 weeks here. Thank you.